All right, good evening. Welcome to our Facebook Live. I'm Mark Wright from King 5 News, along with Dr. Teresa Girolami from Bell-Red Internal Medicine. Doctor, it's good to have you here. You've been on the air a couple of days here with us at King 5, and we appreciate your expertise as people have a lot of questions about the coronavirus.
Yes, thank you.
Good to have you here. Okay, so this is your opportunity at home. If you guys have any questions about coronavirus, any questions at all, Dr. Girolami is going to be here for about the next 20 minutes or so, and we're going to be answering your questions because I know a lot of you have questions. So let's get right into the questions. This one is from Robin Hawks. And Robin has a question about the testing, because I know this has been a big question for a lot of people. Robin says, why are people not being tested unless they show severe symptoms? They say they have enough tests, yet we're having countless stories of people saying they're being turned away. So can you help clear up some of the mystery around what's being done testing-wise now?
Yes, so the CDC came out with very specific recommendations on who should be tested and who should not. So who should be tested are the severely ill. So if you have a high fever, if you have shortness of breath, if you have diarrhea, sore throat, if you've been traveling to an exposed area, if you've been in close contact and you are ill, you will be tested. Everyone else short of that who doesn't really fit the criteria to be tested is not going to be tested currently. In my office, there's no tests I can even run on anyone. It's not available. But today, I got a notice that I'm going to be able to do testing in my private practice, but I'm only restricted to very few tests.
Wow.
So I will have to only test the highest acuity that I actually see in the office. And we're not even supposed to be having the patients come into the office if they're really ill. We're supposed to send them directly to the emergency room.
Wow.
So that's why not everybody's getting tested. And the public health recommendations are if you have minor symptoms, a cough, no fever, maybe a sore throat, then you're supposed to go home, quarantine yourself, stay there, and try to ride it out without any testing.
Okay, so the goal is going to be to have a lot more of these test kits. And as I understand it, the way that they test is they'll take a swab and go pretty deep into the nose or down into the throat so they can get a culture. Then it takes a couple of days after that to know if you have coronavirus. Let's talk a little bit more about who should worry about coronavirus, because we've heard that younger people and healthy people don't have to worry so much, but who really is at risk?
So I think the at-risk people that we are most concerned about are the people who have underlying, what we call chronic diseases. So maybe somebody who's on chemotherapy, maybe somebody on immunosuppressant medication, somebody who's frail, somebody that maybe has severe respiratory disease. These would be the people we would really worry about. And those are the cases so far that I've seen that are the ones that have really fared poorly. Yeah. So those are the people we really need to worry about. I'm sure there's maybe the babies, but although nobody's really had an incident with a child yet that I've seen reported. But those are typically our most vulnerable populations, the elderly with chronic problems and usually little tiny children. But so far, coronavirus, I haven't heard of any children getting it yet.
And the health experts, say that about 80% of people who get the virus show very mild symptoms, right? Mild or no symptoms.
Yes. So the most recent data I saw, which it's changing every day, to be honest, it's a new fact every day. A couple of days ago, they were quoting 1 in 200 people would test positive, and of those, 80% would have very mild symptoms that don't need to see a doctor, don't require to come into the office, and don't require a test.
Okay. Casey asks, should I be worried to go into Seattle? It's really interesting. I took a picture tonight from the window just off here. The baseball stadium's right across the street. That intersection is jammed on a normal day. You could have skateboarded on that street today. There are so many far fewer people coming into Seattle. So what about Casey's question? Should people worry about coming into Seattle, into crowded areas?
I think if Casey's healthy and she's not been exposed, she could carry on her daily life. I would use some caution in crowded spaces. If you didn't really need to go there, I probably wouldn't right now. But generally, yes, I would say you could come into Seattle. Yeah, I don't see very much traffic out there myself.
Yeah.
And there's none on the east side where I'm from either. Everyone's working from home. But yes, I think you could come into Seattle, just, good hand washing, make sure you don't cough on people's. You're supposed to stay 6 feet away from people that potentially could be infected. So just, good health habits.
Yeah, good health habits. Clinton says, let's skateboard in downtown Seattle. That's a good idea, Clinton.
This is the time, right?
Yeah. Linda sent a message on Facebook earlier. Should someone stop taking immune-suppressing drugs for things like rheumatoid arthritis? So there are a range of health conditions that require people to have suppressed immune systems, or they do have suppressed immune systems as a result. So break that one down.
Yeah, that question I would always defer to the prescribing physician.
Okay.
That is something that I would not stop my chronic medication for. I would actually ask my physician, in this case if it's a rheumatologist or an oncologist or who's ever prescribing the medication, I'd defer to them. But I would never abruptly stop my medication without consulting with my physician.
Okay. Christina wants to know, what are the early signs of coronavirus?
Generally, what we've been hearing is a cough, a fever. The fever has to be high, so fever is kind of confusing sometimes. So generally we would say something over 100 degrees. So if you're running 99.0, probably not a fever. It needs to be over 100, and it's a cough, and it's like cold symptoms, maybe a sore throat. Those are the mild symptoms. If people start having shortness of breath or respiratory distress, that is much more acute.
Yeah, we're hearing that this coronavirus is tending to settle more in the lower respiratory system as opposed to the higher respiratory system. So that cough, the raspy cough, fluid in the lungs, congestion in the lungs.
Yeah.
Okay, a couple of questions now about asthma. Sarah Lee says, I have asthma. Am I considered at high risk, and should I avoid large gatherings? And also, Anna asks, what about people with asthma? Should we worry? I have asthma. It's very mild, but a lot of people suffer from asthma.
Yes.
Yeah.
So I had 3 patients with that exact question this week. One girl sent in by her mom, and I just listened to her lungs just to try to reassure her. I think if you have generally controlled asthma, you should be okay. If you have really, severe asthma, I think you should use more caution.
Okay. Jennifer has an interesting question. Can the virus live on soft surfaces, couches, bedding, clothing, etc.? Because you know what they say, we're supposed to cough into our elbow. What about soft surfaces and viruses? Can they live there?
So I just was reading about all the hard surfaces, so that's a great question. I saw no reference to anything about soft surfaces or clothing, but I think in general, if somebody has something in their home, sometimes I have to tell them to use hot water and put all their hot cycle in the wash and put everything in there, which I think I probably would say now, although I have seen nothing in the literature about the soft surfaces.
Hard surfaces, we're hearing what, up to 14 hours, or what is the number?
They don't know.
They don't know.
The final answer was, we don't know, but we think it could live there for who knows, so you should be wiping it all down with some kind of disinfectant and being vigilant.
So we don't know.
We don't know.
But it could. So
it could.
And just be careful touching things like
the
handrails,
the doorknobs, the handrails,
like
all of that.
Yeah. What about cleaning products? Lysol, bleach wipes. Is there anything that's better than anything else in terms of how to kill the virus when it's on hard surfaces?
So the 2 preferred methods that I've seen on the CDC site and every other site are antibacterial soap and water, and then however long you want to wash your hands, at least 20 seconds. And then, scrub them. The dirtier your hands are, the more you need to wash them off. And then the alcohol-based hand sanitizers. And those are the preferred methods right now. Obviously, I'm using Lysol in my toilets and Clorox wipes in my lab and bleach in my lab. So I think disinfecting and being careful is prudent.
Yeah. Jack says, should I cancel a flight to visit my elderly mother? I am healthy, but she isn't. That's an interesting question, isn't it?
That's a great question also, because Honestly, we don't know if we've been exposed because we can't really test ourselves, but we're healthy.
And you can carry it and not know it.
Yeah, you
and
can
be healthy?
carry it and not know it and be healthy and not exhibit any symptoms. I visited my mother with lung cancer in hospice, and I was just very careful. And I'm a doctor who's probably getting exposed. So I was just very careful and did good hand washing, and I didn't cough or sneeze on her or get in her space. And I think if you're cautious, I think you should be okay.
Natalie wants to know, can you get the flu and the coronavirus at the same time? Or how do you, I mean, because the symptoms are fairly similar, aren't they?
Yeah, and I tested someone for flu today, and they were negative.
How soon does that, what's the process to test for flu? How soon does that test come back? Can you do it in the office?
In the office,
oh, really?
yeah.
Oh, wow.
You can do that in office. So you can test for influenza A and B in office, and that is the same way you test. It's a nasal smear, you know, way up the nasal cavity.
Yeah.
So their eyes all water, and they don't like it, but it's pretty effective test, and you get it, you know, 10 to 15 minutes later. So I suppose yes. I don't know why you couldn't get both, and I think they're confusing because they have very similar symptoms. So it's tough if somebody calls and says they have a fever and they sound like the flu. If it was last year, I'd had every one of those people come in the office and I'd test them all for the flu.
Yeah.
So it's been very different for physicians this year to try to triage on the phone and try to suss out, is it the flu or could they potentially have coronavirus? That's a little difficult.
If you're just joining us, Dr. Teresa Girolami is from Bell-Red Internal Medicine in Redmond, and she's here answering your questions about the coronavirus. Let's kind of hit the reset button to talk about just, so it's called the coronavirus because corona means crown in Spanish, and when you look at the microscopic image, it has a bunch of these little crown things. There are other coronaviruses that have spread in the past. It's called the novel coronavirus because this particular one has never been seen in humans, right?
Correct.
So what are some of the other coronaviruses that we've seen in the past?
So we've had MERS in the past.
That's the Middle Eastern?
Yes, and we've had SARS,
right,
which was Asia. We have regular coronavirus, which is just the common day cold, which is just a runny nose and a cold. There was actually a cruise ship talk about coronavirus a few years ago, and that was it. They just spread throughout the ship, and no one died. So this year is different because these viruses tend to mutate and get a little different looking, and then some of them are more virulent than others. Yeah.
This one, we talked a little bit before we went on. How long do we think people are actually sick and contagious with coronavirus?
So they think the incubation period could be up to 14 days. So that's why the CDC put out the recommendation to quarantine yourself for 14 days.
Okay.
But the data I saw recently in our community of the people that we've been able to track, the average was 2 to 8 days. So, and then actually on the CDC site, they are not sure if you're infectious during that period, which I thought was really interesting.
Wow. Let's talk about the development of a vaccine for this. We're hearing it could be next year sometime. Explain to people why it could take that long to get a decent vaccine.
Vaccines are hard to make as far as producing them, getting them FDA approved, getting them mass produced, and getting them out to the general public. That's a very long time in the United States. The best data I saw so far was 9 to 12 months out.
Wow.
I don't know about another country. The United States is usually first and usually find something themselves first. So I'm not having a lot of hope that somebody else is going to beat us to it, but I'm hoping we'll be sooner than that.
We just had a story on the news tonight that there's a local effort to develop the vaccine, and they're asking for volunteers now. So it has to be tested, evaluated to make sure it's safe. And then go through that whole regulatory process, right?
And that's just long in the United States. Yeah, I heard it was a little startup company here, and I heard this about 4 weeks ago, and I had heard that they were very close, but again, the process will hinder its production.
Yeah. How well are we prepared, Doctor, we know that there will be another pandemic, another viral pandemic. I mean, it's the nature of life, right?
Yes.
So how prepared are we as a country? When I look at the response that we're seeing right now, and the fact that we're having to scramble to produce even a few test kits, I feel like our country is not prepared at this point What if this was something that killed 80% of people who got it? You know, and what would the response be like then? How prepared are we?
Yeah, I think that's a really tough question because I think about the flu shot. Every year we get a flu shot, and it is not perfect. It is behind. It is a year behind what the current strain is.
Because it mutates.
It mutates every year. It changes a little bit every year. So they make a flu shot that treated last year's. So when H1N1 came out, they put that in the flu shot for the next year. So sometimes they get it right and it doesn't mutate very much, and the vaccine took a year to produce. I'm ordering my next year's flu shots right now, and we don't even know what the flu virus is going to look like. So we make our best guess. So I do think we're as prepared maybe as we can be. The testing of the kits is an interesting question because that would have been great to know what we were testing for as soon as maybe it came out of China. It would have been great to get on top of that because I think the United States has awesome health care, and I think we have some really bright minds, especially in Seattle, and that we could develop a kit hopefully faster to test it. But I don't think we really knew what we were dealing with, or maybe we couldn't get access to it.
Another question, Christina on YouTube asks, can the virus live in our food supply? So we know that if I cough on you or I sneeze on you or I sneeze on my hand and I shake your hand, that's a pretty good way to transmit this thing. What about in our food supply? If a food handler is sick, can it be spread?
Everything I've read so far doesn't say anything about food. It does say to wipe all the surfaces off because you can touch it and touch yourself and touch your face and your eyes and your mouth. You could transmit it. Yes, you're right, shaking hands, coughing, sneezing. We're testing it in the nasal pharynx, so clearly that's a source. I haven't heard of it being in the actual food chain anywhere, or if you could cough on the food and ate it. I don't think we know that yet.
Yeah, okay. Heidi has a question about, can this virus, does it create antibodies in us, and can those antibodies be then tested for? Does that make sense?
Yeah, I think I think I get the gist of her question. I don't know the answer to that. I'm just thinking about what we talked about a little earlier about H1N1. Interestingly enough, when that came out, or the swine flu, all the elderly people didn't get it. So clearly they had some kind of exposure in their younger life, and maybe they had some kind of antibody to it. So I would imagine maybe you could. I don't know for sure, but if it's anything like H1N1, then you could potentially create an antibody maybe in the future. And yes, you would be able to maybe look at those people's DNA or blood or whatever it takes to figure that out.
If you're just joining us, Dr. Teresa Girolami is with us with Bell-Red Internal Medicine. A lot of people want to know, Doctor, if they do have symptoms, they feel really sick, what do? Like what are the step-by-steps that they do?
If they're really sick, I have a fever of 103, I feel short of breath, I'm coughing, I'm worried I might have coronavirus. That is a call. Well, one of my patients made that call to the ER. The ER deflected her to the primary care office. So I think that's what's happening out there. I think they're calling and they're getting told to call somewhere else because the ERs are just overrun. So when they call into my office, then, or any of us out there, all the docs out there, all the infectious disease, everybody, the pediatricians, we're all fielding these calls. I think we have to make our best determination of whether we need to send that person to the emergency room or not. And if we do, we are supposed to call the emergency room and let them know this patient's on their way. So that's what we've been doing on the ground.
Last thing you want to do is just to walk in anywhere before notifying anybody, right?
Right.
Yeah. Okay. Will coronavirus outlast the flu, or is it like seasonal flu? Could it last all year? You've been reading the literature. You've been talking with experts. What do they think this is going to look like as we go through the year?
I don't think anyone knows. I think that's a very big unknown. It's a little different. Coronavirus has been around forever and ever and ever, but not this particular strain. So I don't think we have any data on that, but the flu seems to be seasonal, right? We have a flu season, and then it kind of dies down, and then it goes away, and then I don't see flu again until December or January or February. So,
And that just really has to do with the fact that we're in enclosed spaces during the cold months, right?
Yes, and that's why I think winter break came in all the schools, was to clear that all out and give everybody a chance to reset. So I don't know about coronavirus, I think we don't know.
What about the contagion, how easily you can get this virus compared to the flu? How contagious is corona compared to just the regular seasonal flu that goes around? Are they both coronaviruses?
The flu's influenza.
So it's a different type of virus?
It's its own thing. I think it's the same as anything. If you cough out on someone, you need to be careful.
Thank you for your questions. Keep those questions coming on the King 5 Facebook page. Let's see if we have some more questions. Margaret wants to know, are the symptoms similar to seasonal allergies? So I'm guessing from what you said earlier, allergies are kind of a nuisance, but you're saying if you've got...
that's a really great question, because I saw someone this week with allergies, and she was nervous about coronavirus, and I said, do you have a history of allergies? She said, yes. I said, well, I see all the cherry blossoms out now. Is this your season? And most people with allergies know when their season kicks in. And she said yes, and she started sneezing a whole bunch, and I had her put on a mask, and she was here about something completely different. She said, I think this is just my allergies, and I think she was right. So that could be, it's tough timing, right? It's tough timing, because now we're going into spring, and now we have allergies and asthma and
all that other
and
stuff.
Everything else going on.
Someone asked if, oh boy, I lost it here. Oh, if you can transmit the coronavirus before you're symptomatic, before you show symptoms.
That's the part we don't know for sure. We don't know for sure.
Let's see. What about if you're pregnant?
So they did put a warning out. The CDC did add over 60 and pregnant women to the list of be extra cautious. And that was just, I think, earlier this week. So they do want you to be a little more careful. So maybe you don't go into crowded spaces, maybe you avoid those meetings, or maybe you don't go in somewhere you might have normally gone. So you are supposed to be a little bit more careful in those groups.
Okay. Zeth asks, I found a home testing kit online. Is that legit?
I have not heard of that.
So I'm going to say probably no.
Probably not, since I was just able to order my legit ones today.
Yeah, and what's interesting is, we've been hearing about these presumptive positive tests, and up until recently, if a local lab tested and it came back positive, that would have to be still sent back to the CDC for them to confirm it to be a confirmed case. So you've been hearing this phrase presumptive positive, and that's where that comes from. But yeah, I'm guessing, and these labs have to be certified by the FDA.
This is a national lab that I'm getting the test kit from, so I'm assuming they just got released a bunch to themselves, and now they're just teasing it out to who can have them.
Yeah. What don't we know about this whole thing? We've been talking about this for the past couple of weeks pretty intensively, but from your perspective, what should we be focused on? Because some people say this is hype, it's overkill, they're shutting everything down, and other people are saying, well, that's what we have to do. So give me your gut feel on what's going on.
I think my gut feel will be somewhere in the middle. So obviously it's terrible for the ones that have lost loved ones. I mean, it's terrible if you're that person, and I'm sorry for all the loss there. That's horrible. Most of those people tended to be elderly or chronically ill. The flu also kills people every year, and we have to be careful of the same groups. So I think to be cautious but live your life, I think would be reasonable if you're not in a high-risk group. Just, again, the good hand washing, don't cough out, don't get in people's private space, and try not to go in areas that are high risk. And if you don't have to be in contact with anybody that's known carrier or not a carrier or not a positive case, then don't. And I think that's reasonable. But I think if school's open, the children should go.
Amelia wants to know, can you get the coronavirus twice? So when we get viruses, our bodies make an immunity to it, right?
Well, we hope.
We hope.
We hope.
that
We hope.
it develops sort of a memory, right?
Yeah, I don't know. This is so new. I don't think anyone knows. I mean,
Yeah.
you certainly can get the flu every year,
Yeah, because
right?
it's mutated,
yeah,
right?
you can certainly
Yeah.
get the flu every year. You can
Yeah.
get strep more than one time. You can
Oh,
get
wow.
mono.
Yeah.
You know, you can get all those things numerous times.
Interesting.
So,
What about Katrina wants to know, can it spread through the mail?
so that was a question on the CDC site today, and it said, as far as anyone knows, no.
Okay.
Yeah, and another question was, what about products made in China? Which I thought was an interesting question.
Yeah.
And they said no. They didn't think that this coronavirus could survive that long of a transit time and all of that. So that was hopefully reassuring.
Elena says in China you have to, in public, you have to stand a meter away from other people and they enforce it. So far in our country, everything has been fairly voluntary. What do you think, as this thing progresses, what do you think we're going to see in terms of mandates, like rules? You know, we're starting to see schools shut down. But what do you think?
Well, I'm hoping we could follow the 6 foot rule, you know, stay 6 feet away. I think they think it's transmitted between 3 and 6 feet or closer. So if you stay 6 feet away, you should be out of the zone.
Yeah.
And I think we should maybe all start doing that. That's hard when you're going through TSA. I mean, it's difficult, but you could do it. I just flew on a plane and I was really paying attention to how all that was going on.
Yeah.
But you could do it. I mean, I stayed way back. It's hard on the airplane, right? You're sitting right next to the person,
Right.
so that's hard.
Well, let's talk about masks, because I've heard kind of some conflicting information, but the overriding thing that I've been hearing is that there's not a lot of data that suggests that masks are good at preventing you from getting sick. So what do you know as a professional?
Yeah,
about
the
that?
data says the people that are sick should be wearing the mask.
Okay.
So they don't spew out the virus. So my patient said to me the other day, "Why are you not wearing a mask?" And I said, "Why are you not wearing a mask?" And she said, "Because I'm not sick." I said, "Well, I'm not sick either, so we're good." But it was an interesting question, because I think I'm much more at risk, you know, because I've already screened everyone. So the mask, well, I will say some new data came out about how physicians are supposed to wear a mask, or actually it's more the people caring for people in a hospital situation. So now if they're going to have more than, I think, 10 minutes of exposed time to somebody who might be sick, they're supposed to wear a mask for no more than 2 hours, and then you're supposed to wear it properly, not on your head or, you know, your chin, and then you cannot reuse it and you have to throw it out. But they don't want anybody double masking, nobody double gloving, nobody double gowning. They said that does not improve anything. But really, supposedly so far, the data has shown that the mask wearers should be the people that are sick.
Okay. Okay, good. That's interesting. Megan asked about dining out. I know that some of the restaurants in Seattle have seen a real drop in their business. What about the dining environment? I mean, when we go out into public.
So I just ate out across the street. And so I'm a test case, so I'll test everything for you. I went over there, and there wasn't hardly anyone in there. First of all, there was no one in there but me. So I felt sorry for the restaurant. But and then I sat at a table by myself, and then there was no one there, so they didn't see. But then they sat someone by me right when I left, but they were still far enough away, and their back was to me, and I felt fairly confident about my dining experience out in Seattle.
I went out yesterday, and I'm going to continue to do that, because these restaurants, they need our support. Shirley wants to know, are skin rashes a symptom of coronavirus at all?
That has not come on the list yet.
Okay.
It's an ever-changing list, so it's not been added.
Cindy wants to know, can you have the virus and not have a fever? Is it possible?
I do think it's possible, but that person would be advised probably to stay at home and self-monitor. So when my patients call in and they say I have a cough and a sore throat, and they have like 3 or 4 things on the list, and they don't have a fever, I actually ask them to monitor themselves for a fever, and if they get one, to call me back.
Okay. So let's go over once again, if you're just joining us, Dr. Teresa Girolami with Bell-Red Internal Medicine. Let's start and just kind of hit the reset button, and then we'll wrap things up here. who should be concerned about getting coronavirus? What are the symptoms, and what's your best advice?
So the symptoms, as we know it today, this week, Monday was a different story, but Friday, the list is a fever over 100, shortness of breath, a cough, a sore throat. Actually, they added diarrhea, and I just saw today vomiting. So, did I miss any? I think I got them all. A known exposure, or travel to an endemic area, but now we have our own our own issues here.
Because we're over 100,000 cases worldwide now, right?
Yes. Yeah. And then we are asking you to observe for those things. And people most at risk seem to be the elderly who have chronic problems. So if you are immunocompromised, you should take care and caution. If you're on some kind of medication that suppresses your immune system, chemotherapy, going through treatment, something like that, you really should use a little bit extra caution. They added over 60 and pregnant women to the list as well.
Okay. Megan wants to know about newborns. Are newborns at a higher risk?
They've not mentioned newborns today.
But they have said that children, for some reason, seem to be less affected by the virus.
Yeah, I think I read one data point in one country where there was a 10-year-old maybe and no one under 10. And then, is it South Korea? I think nobody under the age of 30.
Wow.
So it's looking fairly positive for the youngins.
Yeah, that's good.
Yes.
That's really good news. Heather says, is there an average recovery time?
They're using the 14-day quarantine for recovery. All the people I called this week, I mean, they were all better within 5 days, but they didn't have it. So I think they're using 14 days.
Just because that's sort of safe at the long end.
It's safe.
Kind of like the food expiration thing on
exactly.
on our yogurt
exactly.
in the fridge. Jen, how are we doing for time? Our producer is Jen over there. What's...
We've been going 30 minutes.
Yeah? So how many people are on right now?
We have well over 1,000.
Over 1,000. Okay, well, that's great. Let me just see if I can get a couple more questions, then we'll wrap things up. So yeah, one of the things that seems to be coming up a lot is that there's a lot of stuff going around right now. There's a lot of flu, there's other things. So for those people who are kind of sick, again, restate what they should do.
So honestly, if you're worried, you can just call your doctor about anything.
Yeah.
You know, I have a cough, I have a cold, I'm wheezing, my nose is running, my throat's killing me, and call. And a lot of times you'll be seen. You'll be seen in the doctor's office, and they can sort out what that is. Do you have bronchitis? Do you have sinusitis? Is it allergies? Is it tonsillitis? You can get all of that diagnosed by your doctor. If somebody should suspect it's coronavirus on the phone, we're going to ask you to probably stay home and self-monitor.
Okay.
And then call in if anything changes.
Yeah, and if you get really sick.
If you're really sick, then we're going to be referring you to the ER.
Yeah. I know that you're not in the business of speculation, but do you have a hunch as to what may happen from here on out, or is it just, are we in uncharted territory?
Anytime something new comes out, I think there's a little bit of fear and uncertainty, and nobody really knows what's going to happen. I was just thinking about, I grew up and trained when there was AIDS, and that was killing people, and that was really scary, and I was gowned up in those space suits anytime I went into the room.
Oh, sure.
And so
remember that you don't share a razor blade, don't share toothbrushes,
right?
that was
all of that
fear. Yeah.
I mean, I couldn't even do anything because I had so much gear on. And that we were wrong about a lot of things then, but that was okay. That was just, again, that extra caution. And then we had Ebola, which frankly I was very worried about because that was really scary. And that just kind of went away. I mean, our great CDC and all of our awesome docs,
and Paul Allen and that huge infusion of cash.
So wonderful about trying to, stop that in its tracks, which they did. H1N1 went away. The plagues over our years in our history have all gone away. It will go away. I don't know when. I'm just going to be hopeful and hope. I'm hoping for hot weather and no viruses, but we don't know.
To restate, we're hearing that about 80% of cases
Yeah.
are fairly
Yes,
mild.
yes.
Yeah.
So that's the really good news for everybody out there. Just if you're not sure, call your doctor and they can try to hopefully advise you.
Okay, well, I appreciate all the questions from you guys at home. Thank you so much.
Thank
Dr. Teresa Girolami from Bellred Internal Medicine, thank you for being here.
Yeah, thank you.
Yeah, all right, take care.
Thanks,
Thanks, you guys.
thanks.
We'll
Thank
see you
you.
on the news tonight.
Thanks.